your surgeon will have a lengthy discussion with you about the valve type. Broadly speaking, there are two categories of valves, or two types of valves. One is the mechanical valve, which is a metallic valve, a man-made metallic valve, and the other is a biological valve. You may have heard of a pig valve or a bovine valve. So it is an animal tissue valve. There are distinct advantages and disadvantages to both these valves. So typically, if someone is less than 65 years of age in the UK, it is also a matter of patient's choice. But typically, if you have no problems with bleeding from your gut or any other bleeding tendencies, the surgeon is likely to advise you to have a mechanical valve. The advantages of the mechanical valve are that it will last you lifelong. But the disadvantages are that you would have to be on a blood thinner called warfarin, which will thin your blood maybe 2.5 to 3.5 times what it is now, and you will need blood tests every 2 to 3 weeks to make sure that your blood thinning is in a recommended range for the type of valve that you have. And the other disadvantage of the mechanical valve is in very quiet surroundings, you hear it tick. It doesn't bother most patients, but it is an important thing to discuss with the patient preoperatively. The other valve is the biological valve, and there are distinct advantages and disadvantages of this biological valve. Typically, patients over 65 are likely to need multiple other operations, specifically knee replacements, hip replacements, and we would recommend that maintaining them on a blood thinner is more complicated, and therefore we would recommend that they should have a biological valve. So the biological valve has its advantage in that you don't need to be on the warfarin per se for the valve, although your surgeon may start you on a blood thinner if your heart is irregular or if there are other indications for blood thinning apart from the biological valve. The other advantage of the biological valve is you don't hear it tick. Right? The disadvantage of the biological valve is that, like all tissues, it degenerates with time. So the valve does not last forever. In some cases, I would say on an average, it lasts for about 12 to 15 years in 80% of the cases. It's more in some, lesser in others. So if the valve begins to deteriorate, first of all, when you have a biological valve replacement, you will be on some sort of a follow-up regime depending on local practices. So you will have interval echocardiograms, which are scans of your heart, to look at the functioning of the valve. But if you start to have valve degeneration, you're likely to get symptomatic progressively, and you may start developing symptoms of shortness of breath or develop palpitations or any of the symptoms that you had previously. However, it is also likely to be picked up on serial follow-up when you attend the cardiothoracic outpatients, and if that were to happen, based on what the findings are on your scan, your cardiologist will recommend whether you should see a surgeon or not.